Welcome to Longevity Now, Longevity Now FL. I'm Luigi Fontana, Scientific Director of the Charles Perkins Center Royal Prince Alfred Clinic Longevity Program at the University of Sydney. All the opinions expressed in my videos are my own. So today we are going to answer to an important question that my patients typically ask. That is, to what extent an increased genetic risk can be offset by my lifestyle? In simple words, if I was born with bad genes, changing my lifestyle has or not an effect in modulating my risk. So there are several studies, that can be used to try to answer to this question. And in some of my previous video, I show some data about different populations with different risks. But there is in particular one that I really like. That is this one by Kara et al. Published in the New England Journal of Medicine, one of the most important medical journals in the world, in 2016. So in this study, they basically recruited and studied 55,685 men and women that have been characterized in two ways. So they did a polygenic score. They calculated a polygenic score of DNA sequence of polymorphisms, SNPs. So basically, they took 50 of the most significant SNPs that are associated with an increased risk of having a heart attack, what is technically called a coronary heart disease. And they build a polygenic score with low, medium, high risk, genetic risk based on this genetic sequencing of DNA. On the same patients, men and women, they also performed a questionnaire with measuring lifestyle factors. And I'm going to come back to that, because I think, the criteria they use to define a healthy lifestyle factor or a poor lifestyle factor are questionable from my point of view. But, we'll discuss about it in a second. So the results of this very powerful and interesting study has several points, that I would like to make. One is that, yes, the relative risk of having a heart attack, a coronary event, is 91% higher in men and women with a high genetic risk compared to those with a low genetic risk based on these SNPs, on these sequencing of the DNA and the association of 50 of these high-risk SNPs with the risk of having a coronary heart disease. Okay, this is point number one. But most interestingly, point number two is that even among men and women with a very high genetic risk, a healthier lifestyle is associated with a 46% lower risk of having a coronary event than those with a less healthy lifestyle. And in a subset, they also measured the coronary artery calcification, and they found that those, even with a high genetic risk with a healthier lifestyle, had less coronary artery calcification. So they are very important, okay? Because, and not only the high risk, but in any genetic risk category, a healthier lifestyle was associated with lower risk of having a heart attack. As I said, what is striking is that the definition that they use to differentiate those with a healthy lifestyle from those with a poor lifestyle is pretty crude. So they use the American Heart Association, and in particular, criteria in particular, they said, they decided, that those who have healthier lifestyle are non-obese, so they have a BMI less than 30. And as I explained in several videos on my YouTube channel, you can go from a BMI of 20 when you are 20 years old to a BMI of 25, and you have gained 15, 20 kilos, and therefore you are at higher risk of multiple metabolic abnormalities and cardiovascular diabetes and hypertension and other diseases, and yet you have a normal BMI. You have a BMI of 24, 25. So I mean, these criteria using 30 as a cutoff for being healthy or unhealthy based on body weight, I think it's wrong. So one criteria was having a BMI less than 30. Another criteria is non-smoking, and that's okay. The other one is to exercise at least once a week. Once a week, as I explained in some videos, there is a series of videos on exercise, of the benefits of exercise as a powerful medicine. Once a week is not enough. Even twice a week is not enough. Ideally, we should exercise every day with different degree and different type of exercises, but at least one day yes and one day no, alternate days, to get the metabolic benefits. So once or twice a week is not enough, according to my knowledge. And finally, another criteria for defining a healthier lifestyle was consuming a diet that was poor in processed and unprocessed meat, red meat, and sugary beverages and refined carbohydrates. And it was richer in fruits, vegetables, nuts, whole grains, and fish and dairy. And even here, I have some problems with this definition. I'm not 100% certain that that's the right definition. But nonetheless, they are striking. And the message is that, yes, even if you're born with a high risk of a genetic risk of having a myocardial infarction and heart attack, changing your lifestyle has a powerful effect, almost 50% a lower risk of developing a coronary event, especially, and that's my point of view based on lots of data, if you start when you are young. So this idea that as a teenager or as a children, you can eat whatever you want, because, or you cannot exercise, you can do whatever you want because, you are young and so your body can adapt better, is wrong. The sooner you start to improve your lifestyle, ideally as you are born or even, mom during the fetal life, the better, the lower the accumulation of metabolic molecular risk leading to multiple chronic diseases, including myocardial infarction, coronary heart disease. This is the first cause of disease and death, morbidity and mortality in Western countries. Another important point that was the result of this study is that the self-reported family history of coronary disease is weakly associated with the polygenic risk score, meaning that this genetic polygenic risk score is much more precise in defining if you are at higher risk. Only cholesterol, LDL cholesterol, was modestly related with the polygenic genetic risk, but all the other cardiometabolic risk factors were not associated with the genetic polygenic risk. This means that in the near future, hopefully, every person, when he's young, should undergo a polygenic genetic risk. For example, for cardiovascular disease, that, as I said, is the primary cause of disease and death in Western countries, to understand if they are at low, medium, and high risk. The higher the risk, the more stringent should be the lifestyle changes to reduce the risk of progression into severe coronary disease, and therefore the risk of having a heart attack, an acute coronary syndrome. So hopefully in the near future, instead of waiting for people to have, high cholesterol, high blood pressure as they age, we could, from the beginning, from when someone is born, to determine the risk based on their genes, and therefore have a prescription of lifestyle and other intervention that can mitigate the genetic risk that, as this paper shows, can be drastically reduced with this kind of moderate improvement in lifestyle, according to my data. So I hope, this information is useful for you, your family, for your children. And thank you for listening. As always, bye.